Video is an innovative tool for communicating your data findings verbally. Video reporting can convey a lot of information in a short amount of time and may be more memorable than posters and verbal presentations for many users. Use of video can reach more people than text and is an innovative way to affect an audience's attitudes and opinions about your program, thus encouraging action. Video has a broad reach and would be beneficial for program staff and other users, such as public health practitioners, policymakers, and evaluators. Creating video is becoming more accessible in terms of cost and resources. You may only need a camera, tripod, and microphone, or just your phone, depending on your desired product. Here are some tips for creating effective data storytelling videos that show, not just tell. Be clear about the purpose and obtain permission from any participants before recording. Balance qualitative and quantitative information. Consider the intended audience when determining the ideal video length. Shorter is almost always better. Post the video on both your website and on YouTube to help expand your viewing audience. Consider how your partners can support dissemination as well. Here's a great example of the use of video to illustrate social determinants of health from the Children's Hospital Colorado.
This is Jonathan. Based on his height and sex, Jonathan weighs enough to qualify as obese. Children who are obese face a greater risk for several other conditions. So how did Jonathan get here? It might be easy to attribute Jonathan's obesity to overeating and a lack of exercise. But that explanation, while medically true, can lead to oversimplified solutions that ignore Jonathan's barriers to wellness. These barriers could vary greatly compared to his peers. Maybe Jonathan lives in a neighborhood where it's not safe to play outside. Maybe Jonathan's family can't purchase healthy food. Maybe Jonathan's community doesn't make obesity management a priority. Maybe Jonathan's school doesn't provide physical education. These types of challenges, called social determinants, can include education, culture, income, community safety, home dynamic, behavior, and many other factors. They comprise 80% of Jonathan's health. Clinical care, on the other hand, accounts for just 20%. If we prescribe a clinical solution without factoring in his other obstacles, how could Jonathan possibly succeed? To truly help Jonathan, we can't expect a simple solution to answer his complex needs. Every community has a different set of healthcare needs, and delivering care isn't a one-size-fits-all model. Jonathan's story is just one of many examples that illustrate how considering the real barriers to wellness can change the way we deliver healthcare and the way our population accesses it. The future of healthcare depends on how we support the whole picture of a person's health and well-being. We must implement creative methods to ensure access to care for the entire population, while we also empower communities to focus on prevention. We call this population health. At Children's Hospital Colorado, our aim is to keep kids out of the hospital through preventative programs and partnerships, and by addressing all aspects of their care. Learn more about how Children's Colorado is addressing population health and how you can get involved at childrenscolorado.org/communityhealth.